warm welcome to the news at 8. Thank you for joining us this Friday evening. Let's get you tonight's headlines. Do not clamp down on citizens' SOS calls for medical help through social media. The Supreme Court tells the centre, warns of contempt action against states and the police. Also questions the centre's vaccine policy, asks why there are different vaccine prices for the centre and states. Finally, all Indians above the age of 18 are to be allowed to get themselves vaccinated. But where are the vaccines? Delhi, Maharashtra, Punjab, Rajasthan, Tamil Nadu, they all cite shortages of vaccine stocks. The entire northeast unlikely to begin the process tomorrow. Kerala writes to the centre saying they're short. India reports over 3 lakh cases daily for almost a week now, but the centre rules out a national lockdown. Instead, districts with over 10% positivity to enforce containment measures. Mumbai's daily COVID positivity rate hits the single digits after 45 days, stands at 9.94 in April. The city's positivity rate reached up to 27. A Class 12 student in Andhra Pradesh battling both worry and depression. His father and grandfather are critical on oxygen support. His mother and grandmother are also COVID positive, yet he's expected to take his Class 12 exams next week. And former Attorney General of India, Soli Sorabjee, dies at the age of 91 of COVID. A top story. Hapless citizens who have turned to social media to amplify their pleas for medical help should not face any backlash from the police. The Supreme Court warned the centre and states today as it heard the suo motu case on the centre's management of the COVID-19 pandemic. The court's observations are significant as it comes on the heels of Uttar Pradesh's Adityanath government deciding to prosecute people under the National Security Act for allegedly raising false alarms on social media. This week in UP, an FIR was filed against a man who sought help for oxygen for his grandfather on Twitter.
As a COVID-positive central official started a presentation, the Supreme Court bench made clear their appreciation, saying they favoured collaboration, not criticism. But the court had tough questions for the centre, and some of the worst hit states. The Uttar Pradesh government's move to punish those who post messages on social media seeking oxygen cylinders came in for criticism by the top court. The court said if citizens communicate their grievances on social media, we do not want clampdown on information. Let us hear their voices. There should not be any presumptions that the grievances raised on internet by citizens are false. We will treat this as contempt if any citizen is harassed. On Delhi's situation on oxygen demand and supply, the court pulled up both the centre and Delhi government and said, centre has special responsibility for Delhi and must play proactive role as a national authority towards the capital. This is the commitment you owe to the citizens of Delhi. In the same breath, court told Delhi government, in the extreme times there should not be any political bickering. Politics is for the time of elections. Now the citizens' lives are at stake. We want cooperation. Terming the pricing of vaccine a serious issue, court questioned the rationale behind the centre's dual pricing. It said the national immunization model must be followed for vaccination. Why different pricing of vaccine for state and centre? The centre responded saying that it is taking all necessary action and the situation is not dynamic. Supreme Court asked the centre what steps is the centre taking to curb the spread.
Judges said a short order will be uploaded in the Supreme Court website on Saturday morning and the case will be taken up on May 10th. Meanwhile, the centre will have to respond to the queries raised by the Supreme Court bench. In New Delhi, Arunachalam Vaidyanathan, NDTV.
So we're already reporting over 3 lakh fresh cases a day for a week now. Over 3,000 deaths for the third consecutive day. And this is as per government released data. So how long will this nightmare continue? Let's go across to Arvind for more. The second wave, Arvind, of this coronavirus, I mean, is it likely to peak? Is this the peak, or is there worse to come? Because April so far has been the deadliest month since the beginning of the pandemic. It's just been cruel. So many families ripped apart, children orphaned. So is this the peak? What are the experts projecting, Arvind?
Yeah, Sarah, the national COVID-19 model, Professor Vidyasagar, who is a professor at the IIT Hyderabad, he heads the committee that has been constituted by the central government in June last year. So their team, consisting of 3 important members, including Maninder Agarwal and other experts, have given a fresh projection dated yesterday, that according to the new projection, what they are saying is that the peak of the second wave can be expected as early as next week. So for that, let's put it in context. The earlier projection by the same team, that is on April 2nd, they had a presentation with the central government officials, and then they had projected saying that the peak of the second wave can be expected in the 3rd week of May, and where they said that the cases will be somewhere around 3 lakh cases. But now they have come up with the revised projection. According to the revised projection, the peak can be expected in the next week itself. So that's a very good information that we have got as of this moment. What is the second very important information that we have got from the chief of this particular committee is that during the peak of the next week, we can expect the cases to surge from 3.8 lakh cases to 4.2 lakh cases. So that's scary. That's a worrying. That's a cause of worry. That's what we are getting to hear from him. Also, what he is saying is that after the peak, we can expect the cases to start having a decline trend from the May 12th itself. So this is another important information that they have given as part of the projection. But still, we have to wait for the reality, wait for the numbers to climb down after May 12th. Also, what is another very important information that we have got from him is that even in March, early March, the March first week itself, they did red flag to the central government saying that the second wave is coming. That's what he is saying, that though it's not formally communicated to the government, but it was informally communicated to the government. And the next presentation took place on April 2nd, and then they have revised the projection yesterday. So projecting that the peak of the second wave can be expected next week itself. Sarah?
So peak still a whole week away. Thank you. Thanks, Arvind, for that. So as India is struggling, we're struggling to contain this COVID surge. Tomorrow, May 1st, 2021, was to be the launch of the most ambitious, the most crucial phase of India's nationwide coronavirus vaccination drive, touted as one of the largest in the world. The centre was to set up to open up the vaccination for citizens above 18 years of age from tomorrow, that is the 1st of May. However, Phase 3 of the vaccination drive has run into a roadblock even before it has taken off, with many states and union territories complaining of a shortage in vaccine supplies.
30-year-old Vivian Albert was eagerly looking forward to his first jab after booking an appointment on the CoWIN app 2 days ago. But this message means he won't be able to take the vaccine on the 1st of May.
Earlier today, I got a message from the center that it has been cancelled since there are no vaccination available.
Young India is clearly in for a disappointment. With vaccine stocks in short supply, most in the age group 18 to 44 won't be able to take the jab on the 1st.
सबसे पहले तो मेरी आप सब लोगों से निवेदन है कि अभी कल आप सेंटरों पे लाइन में मत लगिएगा.
We are requesting the people of Karnataka, especially those who are above 18 years up to 44 years, to refrain from going to the hospitals thinking that you may be vaccinated tomorrow.
In state after state, it's a similar situation. There are just not enough vaccines to go around.
We come to you from a vaccination center run by the Chennai Corporation at the Adyar area. A steady stream of visitors under the 45 plus category to get themselves inoculated. But tomorrow, Tamil Nadu will not kickstart the 3rd phase for 18 plus category.
After the state government's SOS, the Serum Institute will now send Rajasthan 3 lakh doses. And to begin with, the state plans to inoculate people between the 35 to 44 age group.
अभी कल हमें पता चला, वहाँ के अधिकारियों को फोन आया कि हम आपको 3 लाख वैक्सीन दे सकते हैं. अब आप बताइए कि इतने बड़ी संख्या है बेनिफिशरीज की, अब 3 लाख डोज में हम किसको लगाएं, किसको छोड़ें?
all states in the northeast will not launch the vaccination expansion as scheduled. What's adding to the confusion, private hospitals so far efficiently involved in the vaccination drive will also not be able to participate in the new rollout.
We are waiting for the SOP from where we have to procure the medicines or the vaccines, because till now we are not contacting any of the private company because it is not available also.
Maharashtra, Bihar, West Bengal, Karnataka, Madhya Pradesh, Punjab, Telangana and Andhra Pradesh. Most states will not be able to inoculate the 18 to 44 age group on the 1st. In Kerala, despite these long lines, the daily vaccinations have seen a dip, crossing the 1.5 lakh mark just twice in the last 10 days. The state government has maintained that their priority is to vaccinate beneficiaries who need a second dose.
According to sources, the state has now written to the centre that due to acute shortage of vaccinations, they are likely to stop vaccinating beneficiaries that need their first dose and instead focus on those that need their second.
Jammu and Kashmir say vaccine manufacturers have informed them it will take at least 20 days for the supply to start to states, as the priority is to complete the central government's orders first.
Manufacturers का कहना है कि जो गवर्नमेंट ऑफ इंडिया के ऑर्डर्स हैं उनको इम्प्लीमेंट करना उनके लिए पहली प्रायोरिटी और स्टेट्स को जो सप्लाई देनी है उन्होंने वैक्सीन की वो देने में उनको 15-20 दिन लग सकते हैं.
And as the country's vaccination drive hits a roadblock just ahead of its most ambitious expansion yet, young India, eagerly awaiting for their turn to take the jab, will have to wait a little longer. NDTV Bureau Report.
And as India enters this critical phase of the vaccination drive, the focus is also on private hospitals. Whether India can accelerate the vaccination process, take it into fifth gear, depends on private-public partnership, on whether private hospitals can procure the vaccine directly. Private hospitals, remember, they're low on the food chain right now in terms of supply. They get preference after the centre and the state. But we are now told that the Apollo group of hospitals and Max hospitals have managed to procure supplies of vaccines and will begin vaccinating Indians above the age of 18 from tomorrow, that is the 1st of May. On schedule. Joining us now, we'll have Shobhna Kamineni, Executive Vice Chairperson of the Apollo Hospitals, and we have Abhay Soy, Chairman and MD of Max Healthcare. Ms. Kamineni, to you first, several private hospitals have been keeping channels of communication open with vaccine makers, even though there's been no clarity on vaccine price or supply for private hospitals. But now you've managed. What was the Apollo Group's COVID-19 vaccine procurement plan, and what does this mean on the ground for those who are keen to get vaccinated tomorrow and have an Apollo hospital in their vicinity?
So, Sarah, we've been talking to each one of the vaccine manufacturers for the last we've been talking to them for 8 months now. And we said whenever there's supply, fortunately, we've been able to get some of that for our people. And tomorrow, it really depends on each state's portal. So please understand, anyone can come if you're 18, if you're registered on the COVID portal. So this is the situation for tomorrow.
All right. Mr. Soy, what does this mean for pricing? Have you, for example, brought from a company or from a state? Because that would determine your price range. I know that Apollo has gotten the vials of Covishield. What about Max?
So, Sarah, Max has also got Covishield, and we procured it directly from the company, from Serum Institute of India. As we speak right now, our consignment is on a flight about to be delivered in the next half an hour. We have the dispatch bills and everything, so we are looking to start this tomorrow. In terms of pricing, our price has been, we had to purchase it at 600 rupees, and then of course there may be a GST element on top as well.
Ms. Kamineni, you didn't respond on pricing. What can we expect in terms of pricing?
So, both the vaccine manufacturers that we have stocks of have been very transparent. It's 1,200 and 600 for Serum. we were able to negotiate for the Covaxin to include 200 rupee delivery charge for us, the administration charge, and that's the same charge that we'll apply on top of the Serum Institute. And then in between, like Abhay said, there is a 50 rupee GST that they are not absorbing.
All right, of course, that's a practical reality. Ms. Kamanini, you said you've been speaking with many manufacturers for months, 8 months now. What about bringing foreign vaccines from Moderna and Pfizer? Can we expect that at any point?
I think those are challenging at this point, and they will be a lot more expensive. We've already started talking to Sputnik. The first lot will come, and that will be fully imported. Indigenous supplies will probably start only end of June. But we do hope that by July, Indians will have a choice of vaccines to be able to, choose what they feel good with. Right now, we have 2 available.
Right now, we have 2. Talking about time, talking about July. Mr. Soy, 4 months ago, people were talking about vaccines expiring. Now you see a complete shortage. How long before you see supplies improving?
Well, I do believe that the productions are being ramped up as we speak. Production of Covishield itself was supposed to go to close to 100 million vaccines a month. So in the coming months, I do believe the vaccine supplies will improve. We need to set up vaccination centers. This is going to be done in conjunction with the government. Of course, it's in collaboration with the government. As private sector players, as Max, I believe we play a small but a very essential role in augmenting the government's efforts to essentially vaccinate as many people as possible, and really to make sure that this national vaccination drive we can cover as many as possible in the shortest period of time as possible. And so we've been working on creating our supply chains. We've been working on
No. Go ahead, Mr. Soy. Go ahead.
So like I said, we've been working at a supply chain like Apollo. We've been in touch with producers for many months now. We believe we are privileged, that we've been able to access this vaccine, which we intend to roll out tomorrow. I'd like to repeat. I'd like to highlight on your show that there are no walk-ins. All bookings will be done through the CoWIN app. So these are going to be pre-scheduled appointments. So as and when the CoWIN app opens up for our particular centers, please book your appointments first and then come, because as you're aware, the central government ruling states that there will be no walk-ins.
So can I just clarify again, there's been this huge shortage, there's been so much confusion over the last few days. Many people who had gotten a slot, gotten an appointment, today got messages saying, no, sorry, you can't come in. The fact that both you and Apollo have managed to get this large consignment, will it, in the immediate future, like for tomorrow, for day after, for this weekend, will it ease things up on the ground for those who have been waiting for the 1st of May, like me, for example, and really want to get vaccinated? Mr. Soy.
I think
so yes,
Actually, anyone. Go ahead, Mr. Soy.
Okay.
Well, yeah, most certainly it will ease up things on the ground. We have returned the government's quota of vaccines, which was with us today. We will be vaccinating people with the vaccines that we procured from the Serum Institute. The pricing will be a little higher, of course, because the government quota, we were doing it vaccinations at 250 rupees, whilst the cost of this vaccine alone is about 600 and plus GST and so on. The price may not be the same, but yes, definitely we would look at vaccinating people tomorrow onwards.
Ms. Kamanini, as Mr. Soy said, you're hoping to back up this government and take this phase, into 5th gear. We need, the clock is ticking. We need to vaccinate as many people as possible. There is a race going on between the number of cases rising in the country and the number of vaccines we're administering every day. Have you been even close to the maximum number of vaccines you could have administered at the Apollo group of hospitals over the past?
Not at all. we've done 500,000 vaccines, probably the largest in the private sector today. And I can tell you that we're today, if you could give us 500,000 a day, we'll administer them. If we had the place, if the infrastructure, and the portal was ready, COVID portal, we would administer. There's one more fact that I really, that you haven't asked, Sarah. This is, I think that some of the vaccine that we've procured, and there's a lot of ambiguity about people and their second dose. So one of the things that we're going to take a call is that those that really, think that there will be confusion for the second dose, but need to get it, and they're willing to pay this higher price. I think that some of this stock has to be reserved because that's the immediate necessity, because these are people above 45, not vulnerable, whereas it's allocated for plus 18 and above. I do think that this is one of the things that we'll keep in mind till the dust settles and the government is really able to, our billing systems, of course, can handle 2 lines of the government of, the 250 and this 600. But if there is a problem, I think that people should not worry that there will be doses there for them for the second dose.
All right. So you're saying the priority needs to be given to those who've gotten the first dose and need to back this up with their second dose on
Just
time.
at the beginning.
When needed in the beginning. All right. Thank you so much, both Mr. Soy and Ms. Kamineni, for joining us. And with this good news, really, that these private hospitals are going to be equipped with vaccines tomorrow for the rollout of the third phase as planned, as per the original schedule. Thanks so much. Now, as the government insists on holding Class 11 and Class 12 exams in May, at the peak of the pandemic, a Class 12 student in Andhra Pradesh is battling both worry and depression. He's already lost his brother, who was in Class 12 last year, in the middle of the pandemic. His father and his grandfather are critical on oxygen support in hospitals. His mother and grandmother are also COVID positive. Yet, this young boy is expected to take his exams. Uma Sudhir has the story.
Sir, like me, there are so many students who are suffering like this, sir. I don't know how they are suffering, but my wish is to bring awareness on all people to fight, not to fight, sir. For requesting you to just postpone the exams for us to refuel it. The exams which we are writing about 20 days or 17 days, ma'am. But that result which we are getting lives lifelong with us.
దయచేసి ఎగ్జామ్స్ పోస్ట్ పోన్ చేయండి. ఇది ఎట్లా ఎంతమంది బాధపడుతున్నారో, ఎవరు బయటికి రాలేకపోతున్నారేమో తెలియదు మాకు. బాబు అయితే చాలా బాధపడుతున్నాడు. నేను 2 సంవత్సరాలు చదువు వృధా అయిపోయిందని. దయచేసి మేము సీఎం గారిని రిక్వెస్ట్ చేస్తున్నాం. ఇలా ఎవరైనా ఉన్నా అందరూ బయటికి రండి, అందరం ఫైట్ చేద్దాం.
ఫైట్ కాదు, రిక్వెస్ట్
చేద్దాం. ఎగ్జామ్స్ పోస్ట్ పోన్ అయితే బాగుండిద్ది.
Our politicians make the rules and we have to live with the results. And finally, former Attorney General of India, Soli Sorabjee, died at the age of 91 of COVID. Soli Sorabjee, one of India's finest legal minds and much more during the emergency. He was a fierce defender of human rights and media freedoms, writing seminal works on the laws governing press freedoms. In 2013, he agreed to become NDTV's media ombudsman as a watchdog of our coverage, and responded to public feedback to NDTV. In 1998, he surprised his liberal admirers by agreeing to become the Attorney General of India under the Vajpayee government, a decision he defended. And everyone from the Prime Minister to the Chief Justice of India have taken note of his passing today, a reminder that India has lost a legal titan to the pandemic.